East and West of India for this grand finale in the 5th Annual National Conference, FeFCon 2022. Also, a warm welcome to all the people who are joined us on the 3D platform. Good afternoon and welcome to all of you. This is the first time which we are doing from the FeFCon Foundation, the annual quiz competition. To start with, I'll just start with the rules and regulations for today's grand finale and also the brief introduction of our eminent jury and the quiz masters, and I'll hand over to them. The quiz is for postgraduate students only. There'll be no negative markings. The winner, basically the round 3 will be decided based on the fastest finger. We advise all of you to use the desktops or the laptops for the better view of the screens. Advised to participate from a place with good internet connectivity. It found to be any type of foul play will be automatically disqualified. Don't use mobile phones for getting answers from any of your colleagues. FeFCon Foundation is not responsible for any form of technical glitches or errors or poor connectivity. Our participation in this quiz implies that participants accept the integrity of all the rules, and participants who are given incomplete or inaccurate personal contact details will be disqualified later. Non-compliance with the rules results in automatic cancellation of the participation and also the candidacy of the prize. The quiz masters and the judges' decision will be final. Coming to the quiz, we have 3 rounds for today in the finals. In the round 1, one question will be asked to each of the participant. 10 marks will be given for the right answer, and all of you should answer within the 20 seconds. Suppose for the question 1, if it's asked for the team A or the first person, then the rest 7 will not answer that question. You can answer the question in the chat box. All of you can see the chat box which has been enabled, which goes to the scorer. So if you know the answer, you can key in the answer within the 20 seconds when the timer is on. And the right answer, whoever gets the right answer will be awarded the bonus marks of 5. This will happen only if the participant for whom the question is asked, if he answers the answer wrong. That means to say, suppose for example, if the question is asked to team A and the person is not answering, in the meanwhile, in those 20 seconds, if the other 7 participants answer the question rightly, then they'll get 5 bonus marks. In case if that participant A, if he answers it right, then there'll be no bonus mark for that particular question. This round will have 1 question to each of you. There'll be a next question, which is round 2, which will basically be an imaging round. This will also be a direct question. 10 marks will be scored against each participant. There'll be no bonus points in this round. And round 3 will be the rapid fire round. There will be 8 questions. 8 questions will be asked, and the fastest right answer will get the marks of 5 marks. So there'll be 3 rounds. After the 3 rounds, the scorer will compile the scores. If there is any tie, we'll have a tiebreaker. The tiebreaker round will have 3 questions. Even after the tiebreaker, if we proceed towards again 1 more tie, then there will be a knockout round of the question. So the quiz masters and the judges' decision will be final. So these are the basic rules and regulation. With this, I would like to introduce our jury for the day today, Dr. Jagdish Chinappa, who requests no introduction, but as a formality, I would like to just take him through the present. He is a consultant and cluster head, Pediatrics, Manipal Hospital, Bangalore. He's been the past President, Respiratory Chapter of Indian Academy of Pediatrics from 2019-21. He's the CEO of Metrain LLP Bangalore. He's also a senior consultant in Bangalore. He's involved in teaching undergraduate students and PG students. And he's also been the past president of IAP BPS, that's a Bangalore Pediatric Society, in 2007. He's been the examiner for pediatrics since 2007. He's been the organizing chairperson of many conferences. He has multiple papers published in various national and international journals. He is an ardent speaker across various forums. He's also been member of the various ethics committees across, and also he's been held various positions at the national level IAP as well as a various government organization. He was been also the COVID-19 task force specialist from the government of Karnataka. Thank you very much, sir. We welcome you on board for as being the jury for the day. Thank you, sir. And also we'll just quickly run through about the our quiz masters for the day. We have Dr. Quizmaster Dr. Anand Kesavan. He's the additional professor of pediatrics from GMC Thrissur. He's also been the IAP Indian Academy of Pediatrics National Vice President for the year 2020, past National President IAP Neurology Chapter, past President Secretary IAP Kerala. He's also been the editor-in-chief of various journals, and also he's been member of FeFCon Foundation and also the other National Advisory Boards of Pediatrics. Thank you very much, sir. We welcome you on board. And the next quiz master for the day, Madam requests again no introduction, but as a formality, I'd like to run through her a brief resume. She's been the chief of pediatrics and neonatology at NEMCare and Rigpa Children's Clinic, Guwahati. She has been the associate consultant, Sydney Child Program, University of Sydney, Australia. Also, she has been the fellow pediatric infectious MCMS, examiner IGNOM, and also she has been associated with the NEIG RHM Shillong. Madam has plenty of papers published and various research work in multiple be it ICMR or International Clinical Epidemiology Network. She has more than 50 papers published in national and international journals. She has been a speaker at various forums, and also she has been editor in board of IAP, and also she has various positions at IAP. And also she has been the chairperson scientific committee of E-Zone of Pediatrics in 2020. She is also the member task force Government of India on COVID-19 preparedness for children. Madam, welcome you all board, and it's over to all three of you. Thank you, madam.
Krishna, one doubt. What about the answer giving chat box? You are given number to them?
Yes, sir. So that's been enabled. The chat box directly goes to the scorer. It goes to no one else.
Others cannot visible it, no?
Yes, no one can see it.
Yeah, okay.
So can we just have a trial? Somebody write something. One of the students can write something on the chat box.
We have the couple of trial questions also.
Yeah, let's try with the trial questions.
Yes, Jignesh and team. Can we
Akila
start?
Reddy has to put her video on. Can you please contact her?
Yeah, I'll do that.
Okay.
Let's start with the trial.
Yeah. So all of you try to answer this on the chat box. Who is the Chief Electoral Officer of India? Rajiv Kumar, Sushil Chandra, Shrushti J. Deshmukh, and Smriti Irani. Time starts now. So the correct answer is that. All of you have written on the chat box, I hope. Okay. So yeah, we can't see that. Fine. So let's try another question till Dr. Akila puts her video on. So who is the Foreign Minister of India? K. Subramaniam, S. Jayashankar, Amit Shah, Ajit Doval. Your time starts now. Okay, so I think all of us should get this correct. So, Krishna,
What about the other answer?
Sir, where you're
Only
breaking.
Shoma.
Yes, sir.
Others also putting more comments.
No,
So
only
we
the
are giving time to.
only the
Yeah,
participants will
only
answer.
participant. Yeah, other 10 of them answered.
Anybody answered?
The chat boxes.
Yeah, scorer, backend team.
Yes, yes, we have received the answers.
All of them are right answer.
So,
Hardik bhai, how many has received the answers?
I have
Right answer.
1, 2, 3.
Others are not able to send the answer or some problem. Or they couldn't understand why others are not send answer.
Some has answered C, some has answered A. 3 right answers.
Yeah.
Yes.
And total how many answers? All of them answered.
So no, we have received
5.
7. 7. Akila Reddy, she has just joined in now.
Okay.
Akila Reddy, she says she has an issue in her video joining, so she has just rejoined again from her phone.
Yeah, so 6 answers we have received, out of which 3 are correct.
Correct. It's okay. Now only we got to correct answer, so there's no problem.
Right.
And can you show the right, who has answered right? Can we have that also shown to them from the backend team?
So who has answered means
Fastest finger.
who has answered first, is it? Hello,
Yeah. Who has answered first?
Deep Kumar Patel. Dr. Krishna?
Yeah. The fastest is the Deep Kumar Patel has answered the first answer, ma'am.
Yes.
Fastest finger for this.
Krishna,
Yes, sir.
my suggestion is let me have access to that.
Yes, sir. Okay. Fine, sir.
So that I can monitor the chat box because
Right,
it should not be with the event manager.
Right, sir. Noted. Hardik bhai?
Okay, I'll make
Jagdish sir as the, yeah.
yeah. But then we have to also score, na sir. That is the issue.
No, you continue scoring. I am only going to oversee. That's all. You can continue your scoring. That's not going to change.
Just a second. Where am I?
I am not going to discuss or answer or anything. I am just going to observe what is happening. That's all.
Right, sir.
Rushi raised your hand. What you want to ask?
Yes, ma'am.
Yeah.
I'm wanting to ask that time is matter or correct answer is matter.
Both.
As like previous,
20.
fastest finger is there as like last previous one.
Yeah.
So
If
we
you
have to
answer-
answer as quick as possible.
If you answer wrong, it doesn't matter. Time doesn't matter.
Time matter. Wrong answer it doesn't matter.
No. See, the thing is, in the first round, you will be all asked individually. Okay. So within that 20 seconds, you have to answer correctly.
Yes.
So in the first round, probably the correct answer is more important. Okay.
Yes.
So that you within the 20 seconds, if you have a correct answer, you give it.
Okay.
But in the the third round, it will be different.
Rapid fire round. Third round. Okay. Yes.
Fast in this thing, no?
Got it.
Right?
It. Yes.
Excuse me, ma'am. Should we answer in the chat box?
I think Akila, you joined late. I think you just have to go through that once more. Please explain to her once more.
Yeah. See, Akila, round 1 and round 2, there will be direct questions, one question to each of the participant. Okay. When a question is asked to a participant, the other 7 people can answer within the 20 seconds. That answer will be considered only if that participant whom the question is asked has not answered. Then the people who have answered right in those 20 seconds will be given bonus points of 5 marks. This will happen for round 1 only. In round 2, there'll be only one question which will be asked to each one of you. Okay, but there'll be no bonus points. Round 3, there'll be 8 questions which will be posted, multiple choice questions. You need to pick the right answer within the 20 seconds. The fastest right answer will be the winner for that particular question and will get 10 points. So end of 3 rounds, after round 1 and round 1, 2 and 3, the scores will be computed and winner's position will be decided for first and second position. Suppose if there is a tie, there will be a tiebreaker round of 3 questions. Even again, if there is a tie, then we'll go for a knockout round of 1 question. Clear, Dr. Akila and all of you?
Yes, sir. Yes, sir. So we have to answer directly.
Yes, round 1 and round 2 will be a direct questions. But during those questions, suppose if the question is asked for a person team A, where Akila is not being asked, then still you can answer it. And that answer of Akila will be counted if that person answers it wrong. And if you have answered it right in those 20 seconds in the chat window, the scorer will consider your answer and you'll be given a bonus marks of 5 points in round 1. So in round 1, you have an opportunity of scoring 35 points by bonus marks only, provided other 7s are answered as wrong. Okay. Any question, Dr. Jivansha, Dr. Deep Kumar, Dr. Kunal, Dr. Anirudh, Dr. Naveen?
Hello, sir. We have to, if question is asked from my team, I have to say in voice or in chat box?
Voice, video voice.
Okay. That was
By the moment you tell the answer, the timer gets stopped.
okay.
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 Yes, sir. Madam, sirs, can we start?
Okay, we'll start. Madam,
Yes,
you can
please
start.
start. Please start.
Yeah, back in team.
So I will be going by alphabetical order, like Akila, Anirudh, Deep Kumar, Kunal, Jivansha, Mamta, Naveen, Rushi. Okay, as per the alphabets of first alphabet of your names. Fine. Yeah. So we can start like that the first round. Okay. Krishna, you are.
Akila, can you put your hand down, please?
Yeah. Jignesh, Hardik.
And one more small thing, kindly mute your, be on mute till you have to answer. Otherwise, there may be some background disturbance noise.
Sir? Sir, others should answer in chat box, sir.
Madam, when the question is directly at you, you answer.
Yes, sir. Others?
Supposing the person who is to answer does not answer, then you put your answer in the chat box.
Okay.
If the person has answered correctly, you will not get any marks. But if the person has not answered or answered incorrectly, the first person who will get the bonus marks.
Okay.
Is it clear?
Thank you. Yes, sir. Thank you.
Okay. So we can start. Can you display the first question?
3, 2, 1, 0.
Yes, countdown. So this question is for Akila. H pneumonia is interstitial pneumonia seen in which condition? Your time starts now.
Ma'am, measles.
Excellent.
Answer came there. Some mistake there.
I think it was seen.
I have said it. I have said it before.
Yeah.
So Jagdish sir can take this.
I think the technical team is not. Technical team, can you look at this, please? The choices have not come on the board.
Krishna, otherwise I'll email to you what I've done yesterday with my questions.
Okay.
Which answer came there?
Hardik there?
Yeah, so Jagdish sir, the first round will not have MCQs. It will be direct questions and no options.
Okay, fine. So then let's do one thing. I think we should grant it to Akila because she answered before the answer came up. I think that's fine. We'll pass it. That's okay.
Okay.
Sir, I have the PowerPoint with me without the answers. So I think I should send it to the backend team, no?
No, ma'am, they have it. They have done it. Actually, there is a technical glitch. I think they'll correct it now. Hardik?
No. In fact, the one which was sent to me today also had the same thing.
Ma'am, that was for our reference, internal reference.
Still, I'm sending you.
Yeah, okay. We'll note it.
That will not have timer.
Yeah. So you please remove the highlights and the highlights and the answers from your choices, please.
Yes, ma'am.
Dr. Anand,
Yeah,
till they are doing this, do you want to say anything about pneumonia, H pneumonia?
no, well, it is a very severe pneumonia, and you get especially when there is a immunosuppression. HIV, some other immunosuppression, then you will get such a form of pneumonia with measles. Otherwise, it is not very common nowadays.
So measles itself is it immunocompromises. So if the child has failure to thrive, then probably these children will get more of the pneumonia even though they're not HIV positive. The other pneumonias which are found in measles are the superadded infection, which is a staph pneumonia. So whenever, for the sake of the patient, whenever we see such a patient, we will always cover for staphylococcus. Right, sir?
Yes.
I think the important thing for PGs is that measles can produce pneumonia in many ways.
Yes.
The one is direct invasion by the virus. The second is an immunological reaction and diffuse pneumonia. Third is, as Madam mentioned, immunosuppression in a malnourished child with bacterial pneumonia, and it can also aggravate tuberculosis. So you can get disseminated miliary tuberculosis post measles, especially if there is a child has got malnutrition. You can also get, if the child has got double whammy of malnutrition, HIV, and measles, then you can end up with very severe complications. You can also get fungal pneumonia following measles infection. So basically, HEC pneumonia is a pneumonia which is non-infectious in nature, bilateral, interstitial, supposed to be related to an immunological reaction to the measles virus.
Hardik, are we ready with this?
Yes, we can go.
Yes.
Okay, then we'll go to the second question. This is for Anirudh. So Anirudh, name the antifoliate agent used in the management of bronchial asthma. The time starts now. Anirudh, you have to say the answer. Okay. So Anirudh did not answer. Can we have the responses from the rest of the participants? So Anirudh, you didn't know the answer to this? Oh, where is Anirudh disappeared?
Ma'am, we are unable to answer, ma'am. In chat box, it is showing that we cannot answer.
Okay.
No, I already received answers in chat box. From Naveen Kumar, it's Omalizumab. Then Jivasha Dua has replied MGSO4 and Punalakshi has replied second Trimethoprim.
No, sir. Like I'm getting that you cannot chat with Anand Keswan during this meeting. This is what I'm getting, sir.
You need not to send to Anand Keswar.
Scorer.
So
Scorer.
where, like in chat box?
You see, there will be an option to scorer direct message.
Okay.
Check that.
And Dr. Akhil, if we request you to, if
Oh, I
possible,
think
log in a laptop, please.
Anirudh got logged out. He has joined now.
Sir, actually, right now I'm in the conference, sir, so I'm not finding a charging cable to use that.
Anirudh did not reply to this, so we will give it to the other participants. So should we discuss the correct answer, sir?
Yes, sir.
I have not got access to chat now, by the way. Dr. Hardik.
Sir, if we give it to you, I will not be able to see. That is the issue. Because
Okay, fine, fine.
only to host. That's why.
So we'll discuss till you can give us who is the correct, how many people have answered correctly. So can you show us the answer, please? So the correct answer is methotrexate. This is a disease-modifying agent, and in very severe cases of asthma, you might have to use it. Of course, I think with the newer drugs like omalizumab and all, probably those will come first before methotrexate. Anand sir, do you want to add anything on this?
No, methotrexate, I think there should be answer from everybody because anti-fault agent, methotrexate very commonly using. Now, what are other conditions we can use? For rheumatoid arthritis, other inflammatory immunological conditions also we can use methotrexate.
Sukumaran sir has joined in, sir. Welcome.
Yes.
Okay, right.
Yes,
See, the thing is that methotrexate is very, very rarely used because, as Madam has said, we have got other biologicals like omalizumab, benralizumab, dupilumab. A number of new drugs are available now, but it can be used as. And the question is also anti-folate agent, so it is very easy for the students to answer. Then, as Anand said, there are other indications for methotrexate also. And also another drug that is used just like methotrexate is gold salt. Gold is also being used for resistant asthma, very, very rare. But now with the advent of biologicals, we go for biologicals in difficult to treat asthma.
Yes. So Hardik, can you tell us whoever has answered correctly?
No correct answer, ma'am.
No correct answer. So okay. So
Actually, I've sent it, ma'am, methotrexate.
It was like very late, 5 minutes after.
Actually,
So-
okay, ma'am. I sent it directly in the chat box, ma'am. So I wasn't
Correct.
able to send it.
But 20 seconds is the time.
Okay.
All of you, please, when the timer is on, please share your answers.
right? Yeah. So we'll progress to the next one. Deep Kumar will be the direct question for you. Deep, this inherited disorder presents with neonatal cholestasis, infantile cirrhosis, and emphysema. What are we talking about? Your time starts now. Please unmute and answer Deep within 20 seconds.
Deep, we didn't hear you. You're muted.
Please unmute. Okay, we'll take it that Deep has not answered this question. So the rest of you, I hope you have given your answers in the chat box. The correct answer to this is, can we show the answer, please?
Yes.
The answer is alpha-1 antitrypsin deficiency. And this initial phase of life, it will usually present with neonatal cholestasis. And later on, because of the persistent cholestasis, there will be cirrhosis and emphysema. But it is not that all patients will have all the features. So in later life, if someone presents with a emphysema or a cough which is not going, we have to suspect this condition. Sukumaran sir, Anand sir, you want to add to this? What is
Okay.
the
As Madam has correctly said, the answer is alpha-1 antitrypsin deficiency. Even though it is a very rare disorder, it is one of the cause metabolic condition that can present with pneumatic cholestasis. So if a child is having a liver disease with respiratory problem, we must think of alpha-1 antitrypsin deficiency. Both liver and lung is affected, it may be alpha-1 antitrypsin deficiency. And one of the differential diagnoses may be cystic fibrosis. Cystic fibrosis may be.
Yes. Anand sir, you want to add something?
That is okay.
Okay, so Hardik, do we have any responses?
Yes, we have 3 correct answers from Dr. Akhila Reddy, Dr. Anirudh Nelly, and Dr. Naveen Kumar. Dr. Rushi also answered correct, and Dr. Kunal also, but after 20 seconds.
Okay, so within 20 seconds, it was 3 people. So very good. I think now you've got the hang of the thing. So we will go to the next question, which is for Dr. Kunal. You can unmute your and be ready, okay? So Ellis curve is seen in which condition? Your time starts now. Rest of you, if you know the answer, within 20 seconds, please post it in the chat box. Okay, so the no answers from Kunal. We'll show you the right answer, which is in pleural effusion. So can you just show the answer, please? Dr. Anand, you want to add anything on this? Why it is called the Ellis curve and such a
It is a very simple 4-5 important X-ray X-ray findings are there. One is the mediation shift, uniform opacity, mobilization of the costophrenic angle, and last one is Ellis curve. So I think it's radiologically very simple. I think highest level in the axilla due to capillary action. So Ellis curve is seen in pleural effusion.
And also, you can clinically suspect also, as Anand said, when you percuss, if there's a higher level in the axilla, then that will be the Ellis curve, S-shaped curve, higher level of fluid in the axilla.
So what
happened? When we were students, we were all taught like this, Ellis curve, even though it is not very significant.
Yeah. So I think what is at work in the pleural cavity is the physics is at work, right, sir?
Yeah.
Where the a part of the fluid is up and the other part is down, and therefore it creates a curve in the fluid level, if I'm not mistaken.
Yes, right. You're right, madam.
Yeah. So this is physics at work in medical science. That's why we have to do physics as an in class 11 and 12. So Hardik, since the person did not, Dr. Kunal did not answer, who are the others who got it correct?
You have 5 correct answers from Dr. Akhila, Dr. Anirudh, Dr. Deepak Kumar, Dr. Jivasha, and Dr. Naveen Kumar.
Very nice. Good.
There is someone who is answering Mamta. I
answered within 20 seconds, sir.
Yeah, but I don't see your name in the list of participants.
She's there. She's there. Mamta is there. She's one of the
Sir,
participants.
I have also answered correct.
Sorry?
So Hardik.
Yeah, Mamta name is actually, the full name is K-A-T-E, Kategaru Mamta. That's why you might have missed out.
Okay, right.
K-A-T-E-G-A-R-U.
Okay, it is written Kategaru M. So
Yeah,
okay.
Okay. So now not bad. I think this was quite interesting. So can we go to the next question, which is for Jivansha Dua? Will you please unmute yourself so that you can answer fast. India ink preparation is used to identify which organism? Time starts now.
Cryptosporidium neoformans.
Very good. Very good. Cryptococcus?
Yes, neoformans.
So we'll give her full marks for this.
Yeah.
And the rest of the people, I think the answers will not be counted for. So, Anand sir, you want to add why India ink?
I don't think it is a importance of examination with a simple test like Indian ink preparation, because very diagnostic and will get a 100% diagnosed with a simple test like Indian ink preparation, which we are not nowadays very commonly using, but it's very useful.
It's a theoretical question, but in the CSF study, this is the CSF. You must do an engineering preparation, the CSF in children with a chronic meningitis. In chronic meningitis, one different diagnosis is TB. In chronic meningitis, you must do this engineering preparation to diagnose cryptococcal meningitis.
And also in those patients who are immunocompromised, if they
Right,
have
ma'am.
HIV, then
Yeah,
this is an organism which you'll have to think about. So when you send the CSF, you have to specifically ask the microbiology department to do an India Inc. preparation. This preparation actually helps to identify the organism by staining the capsule of the organism. Right, sir?
Okay.
Yes.
So backend team, Hardik, any correct?
No, answer the question answered, na?
Yeah, question is answered. So we will
So
not.
there's no question of
No bonus marks.
Yeah, okay. So we'll go to the next one, Mamata. This is for you. A child presents with seborrheic dermatitis, lytics, skull lesions, ear discharge, and hepatosplenomegaly. What are we talking about in this patient?
Time start now.
Mamta, please unmute yourself.
Mamta. So this is multi-system involvement. So seborrheic dermatitis, lytics, and I think catch point here is the ear discharge and the lytic skull lesions. So the correct answer for this is actually Langerhans cell histiocytosis. You could display the answer, please. So Langerhans cell histiocytosis, initially you'll get very typical seborrheic dermatitis, then you'll have ear discharge, and some of these patients can also have icterus, jaundice, and they'll have hepatosplenomegaly. And when you do the x-rays, you'll get these typical lytic skull lesions. So this is very, very typical of this condition. And Sukumaran sir and Anand sir, you want to add anything on diagnosis?
Previously, when we were students, we call this condition together as histiocytosis. Actually, there was histiocytosis X. There are 4 diseases included under 3 diseases included under this. One is eosinophilic granuloma, lateral severe disease, and the third one is Hans-Schuller-Christian disease. Hans-Schuller-Christian disease. Hans-Schuller-Christian disease has got a triad: proptosis, diabetes insipidus, and ocular lesions. And now it is called Langerhans cell histiocytosis. This affects almost all systems. Even lung can be affected. There will be cystic lesion in the lung. They can present with a pleural effusion also.
So it's a very typical clinical picture. Hepatosplenomegaly, skin lesion, ear infection, and also you may get any bone lesion, but commonly skull bone, but it may involve long bones also. Femur and the humerus also can be affected. So very vertebral also involved. Then in that case, we get a vertebral fracture, paraplegia, something like that. So it is a very typical clinical picture.
Yeah, and the therapy for this condition is with metabolites. So we have to use chemotherapy. So Hardik, any of the other people have got it correct?
Yes, ma'am. We have correct answers from Akhila Reddy, Anirudh Nelli, then Kunal Kashi, Naveen Kumar, and Dr. Jivans has written just histiocytosis. So whether it is considered correct?
We can accept that. Yeah, we can accept that. Sir, we can accept it?
Yes.
Yeah. So very nice. So we'll go to the next question, which is for Naveen. So Naveen, you please keep yourself unmuted. Next question, please. Question number 7 of round 1. What is the most common etiological agent for croup? Your time starts now.
Hemophilus influenzae. Influenza virus.
So we will look at the correct answer now. Can we have the correct answer being displayed? So it is parainfluenzae virus. So you said Haemophilus B first.
Then change to para-influenza.
That cannot
Only
be
one answer. You have to give us a simple question.
So we will have to disqualify your answer, Naveen.
There was rule for changing option in 20 seconds. I changed that.
Was it there, Krishna? I don't remember seeing.
No, there was no.
No, there is no rule. Okay. So it was correct answer within the 20 seconds. So I think we will have to wait for Hardik to tell us who others have got it correct. Anand sir, you want to add anything on parainfluenza virus and group? For the benefit?
I say group is very common.
One more thing, I want just one. Anand,
No, you can.
Anand, I just want to comment. He has talked about Haemophilus influenza. H influenza will produce not croup. Actually, it's a viral croup. Actually, H influenza will produce acute epiglottitis. Previously, we thought H influenza is the commonest organism that produced this acute epiglottitis. Now, because of the vaccination, the commonest organism is either pneumococci, staphylococci, or streptococci. These are three common organisms that produce even epiglottitis, that is bacterial croup. But viral croup, because you said it is more commonly produced by parainfluenza, and also other viruses can also produce, like even RSV can also produce croup. But commonest will be parainfluenza.
Anand sir.
Yeah, nothing to add more.
One of the commonest causes of croup now will be the coronavirus.
Yes.
In fact, if you
Okay,
look at the current literature, you would find children who have got COVID-19 having a significant croupy cough. So it is now known that it affects the upper airway quite significantly in small children. So parainfluenza may be one of the commonest but again depends on the epidemiological issue of viruses, because again you see viruses come in waves. So if you have a wave of coronavirus now, then the commonest organism will be COVID-19. And if there is no COVID, then it could be most likely parainfluenza virus. So, but again, as Madam mentioned, viral etiology is common. Parainfluenza is the commonest of those, but the host of other viruses can also do it. And if any intelligent person wants to comment, which is the one bacteria that can produce croup?
Coxsackie.
Anybody?
It's a virus.
Coxsackie is not a bacteria.
A virus.
Which is the one bacteria that can produce a croup? Gold medal from me. Yeah. Mycoplasma pneumonia. Mycoplasma pneumonia can produce croup in older children and adolescents, exactly mimicking a viral infection. So that is another organism that can produce croup. Okay. Right.
So in fact, Jagdish sir, this COVID, one of my own classmates, a medicine specialist, had the acute laryngotracheobronchitis and he nearly died, but he was saved by his pediatrician wife, who gave him the adrenaline nebulization and the steroid injection at the right time. So I think it's a very important point which sir has made, that now we will have to think of COVID-19. So we'll go to the last question in this round. Hardik, you want to tell us? Anybody else?
Yes. So we have 5 correct answers from Dr. Akhila, Dr. Anirudh, Dr. Jivansha, Dr. Mamta, and Dr. Rushi.
Okay, good. So I think we'll go to the last question in this round, which is to Rushi. So Rushi, please unmute yourself. Can we have the question number 8? Terminal complement deficiencies are at a higher risk of infections due to which organism? A. Neisseria, B. Listeria, C. E. coli, and D. Pneumococci. So your time starts now.
Nigeria.
Let us look at the correct answer. Can you please display the correct answer? So the correct answer here is pneumococci. Can Hardik, when you're looking at the responses from the rest, Dr. Anand sir, you want to add anything for this terminal complement deficiencies? Why pneumococci?
I don't know. The answer is pneumococci.
Yes, pneumococci. So would you like to add anything to this for the students' benefit? Sukumaran sir?
No, it's a difficult question.
Yeah. No, not difficult question. Answer is difficult.
Yeah.
Because it's not the
easy.
answer. It's not the answer.
So usually the capsulated organisms are the one which will cause infections in patients who have these terminal complement deficiencies. So first, I think will be pneumococci, and then followed. We are asking the which is the highest, higher risk of infections. So the first organism is always pneumococcus in this. Okay. Hardik, what about the answers from the rest?
Ma'am, everyone has answered A.
A.
This
Yeah.
Neisseria.
You have to give mark. Krishna, it is mistake from.
Highly consider.
Pardon, sir?
We can give judges. We can give mark to A only.
Because even Neisseria causes it. So
Neither meningococci is there.
No, the direct question, Dr. Rishi himself, he told it as Neisseria. So
I think we should kindly consider.
I think we should not consider. The correct answer is pneumococci. I think we will give marks for pneumococci. Otherwise, there'll be a lot of confusion will be there.
Boss, Dr. Jagdish, what is your opinion?
I have to go by the opinion of the judges. I am only a observer, so I will not interfere with what Dr. Sukumaran and you decide.
Yeah. So I think the correct answer is pneumococcus. For this, among all the choices, actually it is the best choice you have to give. You all are experts in that, having gone through the postgraduate entrance examinations. So we will take it as nobody has answered this correctly. Okay. So we come to the end of the first round, and I will ask Hardik or the scorer to please let us know what is the score at the end of round 1. Of course, till then, I think we can discuss that now with the universal pneumococcal vaccination, which is occurring even in our country, maybe probably in the next few years, this organism will change to Neisseria meningococcus in the theory. Yeah. So Akhila has scored 30.
Yes.
Anirudh 20. Deep Kumar 5. Jiansha Dua 30. Then Mamata 10. Kunal 5. Naveen 15. And Rushi 10. Not bad. I think there is all of you have attempted in the first round. So very good. And we will go now to the next round. Dr. Krishna, can you read out? We will be showing the rules again for the next round.
Yes, ma'am.
Yeah. So in the next round, please display the rules again so that the students are not confused.
Yeah. Are you able to see this screen now?
Yeah.
Yeah. In the round 2 now, this will be the basically a image round where a direct question will be asked to each one of you. There'll be no bonus marks or no pass on.
Actually, direct question, no pass over.
Yes.
Yeah. So which means all of you will get one question.
Yeah.
And you will get marks if you're able to answer. The rest of you, we will tell you what is the answer. Okay.
Please switch on you are this one when you are answering only. So keep your this one unmuted.
Yeah. So this round, what I'll do is I'll start from Rushi. We'll go backwards from R to A. Is it fine? So that nobody feels that they have got some hard questions and others have got easy questions. Okay? Yeah. So we will right, Krishna, is this okay with you? Yeah. So we'll start with the second round, which is basically an image round. Look at the picture. Most of them I think you should be able to answer because it's like a snapshot. Can we have the questions, please? Round 2. The whole of medicine is actually more with images. So Rushi, this question is for you. A 2-year-old comes with recurrent fever and pneumonia with the following X-ray. You found in your OPD that this is the X-ray. Now look at the X-ray and tell us what is the abnormality. Remember, this is recurrent fever and pneumonia at 2 years of age. So multiple episodes. Your time starts now.
Hyperinflated lung is there, and prominent bronchovascular marking are there. More in left side haziness, then right in lower middle zone there is a consolidation would be.
What is missing?
Missing in tracheal set.
Okay. So the catch in the question was that at 2 years, this child has had recurrent fever and pneumonia. So obviously there is something which is happening with the immune system of this child. Okay. So that means something is wrong. So let us look at the answer. Before we show the answer, just stop. Yeah. Okay. Did any of you think that this child? No. So you look at the X-ray, this part, in a 2-year-old, we expect some thymic shadow to be there. All right. So this is an absent thymus, which could explain why this child has had repeated infection. So Dr. Anand, Dr. Sukumaran, you want to add anything on why thymus is important?
See, in a child with a recurrent pneumonia, always one should think of immunodeficiency. When you suspect immunodeficiency, I tell you a tip. Tip is SPUR, S-P-U-R. S stands for serious infection. P stands for persistent infection. U stands for unusual infection. And R stands for recurrent infection. So if a child is having a serious infection, persistent infection, unusual infection, and recurrent infection, you must have an immunodeficiency in your mind. And X-ray, look for thymus. Thymus will be absent. And also, clinically also, you must look in the throat in all these children. Throat. And look for absence of tonsils and absence of lymph node. It may also give a clue for A gamma globulinemia in a child.
Anand sir?
Yeah, I think recurrent pneumonia, the causes are already enlisted, the immunodeficiency, chronic heart disease, congenital malformation, and other aspects you have to think about it. Here, I think we cannot see, and also usually sometimes you get sales sign. Sales sign means you can get the thymic shadow. In the chest X-ray, usually called the sales sign also. So here it is not visible. So I think here the right answer is athymia or absent thymus.
Yeah. So this is a very important clue. When you look at primary immune deficiencies, there are 10 points, of which some Dr. Sukumaran sir has already mentioned. And when you look at the X-ray of a younger child of below 2 years of age, always make it a point to look at this part and the upper part where the thymus is there. So I suggest you look at more X-rays and you'll see what a sale sign is. You will understand. They actually look like masses. If you do not know, you might think them to be pneumonias or some tumors, but actually they're normal thymus. And then they regress slowly and disappear. So we will go next question, Dr. Naveen. Next question, please. So a 5-year-old girl was brought with a history of recurrent fever for 3 weeks with the appearance of this rash, which you can see in the body. Can you see the macular kind of a rash? With every bout of fever, the rash used to come. And on examination, this child had hepatosplenomegaly. So in this condition, what is the condition that this child is having? What is the most likely diagnosis? Dr. Naveen.
SLE.
Okay. No. But the rest of the people, do you want to just tell us what you thought about? Any thoughts?
Systemic GIA.
HSP.
Right.
So Kunal has said systemic onset GIA, and that is the correct. So no direct marks for Naveen, and unfortunately no marks for you, Kunal. but excellent answer. This is systemic onset JIA. The rash, the fever, which is for a prolonged period, along with hepatosplenomegaly, you have to always think of systemic onset GIA. And these are spiking.
Arthritis. One more thing about the rash is transient, appears along with fever, and may be associated with anxiety. Stress will produce rash, and also trauma can also induce a rash in a child with systemic onset juvenile rheumatoid arthritis.
Kunal is from PGI.
Yes, ma'am.
Yeah, so he must have seen lots of these cases and he must have thought why this question didn't come to me.
Okay.
But that's how it is. Anand sir, you want to add anything?
Is there an arthritis?
Yeah.
Pardon?
Arthritis.
Okay.
Yeah.
Hello.
So this is systemic onset GIA. So now next question will go to Mamata. This 2-year-old child with acute onset high-grade fever develops this rash during the hospital stay. Is very sick. What is the most likely diagnosis? Time starts now.
Meningococcal infection.
Very good. Meningococcal infection. What are the lesions known as? You are correct. We'll give you full marks. But what is the lesion known as? What are these? Okay. So she has got it correct. We will give her the full marks. The rest of you, what are the lesions known as?
Perforated fulminans.
Fulminans.
Fulminans. Okay. So this can happen during the hospital stay, or it can even the patient can come with this rash. Sir, you want to add anything, Anand sir?
Yeah.
There are two things are there. Now we are widely using both the H influenza and pneumococcal vaccine. So now meningococcal vaccine is on the rise. Even though meningococcal vaccine is there, we are not right using. Second thing is that don't wait for the result for any investigation because it is life-saving. So you have to start a drug immediately. Third thing is that we can get the right diagnosis from the skin tapping. You can get just a local examination and you can do a microscopic examination from the local. This one, so you'll get a gram-negative diploma. So all these things are very important.
And the students should know what is Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome. In meningococcemia, this children will present with a shock due to adrenal hemorrhage. That should also be there. So must monitor BP in all these children with meningococcemia.
So Mamata has got it correct. So full marks to her.
One small query to any of the participants. I'm sure that this child will be treated with either penicillin or ceftriaxone and taken and isolated. But what other treatment will you do? What other things that you need to take care of other than treating this?
For contacts.
Prophylaxis
Exactly.
to the
So you
contacts.
need to treat the contacts. And what will you treat them with?
Earlier they used to use rifampicin, but now they've changed the drug.
Quinolones. You can use either quinolones or rifampicin.
And you have to vaccinate. Okay. One case of meningococcemia means that it can spread. So the surrounding, the people, the nurses, the healthcare workers must get vaccinated. So can we, very good. Next question will go to Jivansha Dua. Can we have the next question, please? Spot the diagnosis in this 10-year-old boy with fever and pain abdomen. Your time
It's
starts now.
Henoch-Schönlein purpura HSP.
You are
HSP.
100%?
Yeah.
Lock kar do?
Yeah.
Okay, excellent. In a few seconds, the answer. This is very typical. This is Henoch-Schönlein purpura, where you see these regions. So you can display the answer. Why the pain abdomen occurs in these children? Sir, you want to add why the pain abdomen? Why the rash? Anand sir?
So you'll get a syndromic, so many features like commonest one is skin rash, then you get arthritis, then you get abdominal pain, then you get a renal involvement. Rarely you get a neurological features also. So you'll get a rash mainly on the dependent part, usually below the buttocks area because of the gravity, because it's a vascular purpura. And usually you can treat without much complication. Symptomatically it is improved. Very, very rarely you may get a complication of due to involvement of renal involvement. That is also more common in adult, but in pediatric age group, usually they will make a wonderful recovery.
See, now it is seen that it can affect most of the systems. You can have lung involvement, pleuritis, pancreatitis, and male children, orchitis is very common.
But you need to keep these patients on follow-up for the renal functions, because sometimes, occasionally, there would be 1 or 2 patients who will go into chronic renal failure even without you knowing it. And some of them can have recurrent HSP occurring. Okay, so I think
one quick question, Rashna, and that is, supposing I said that spot the diagnosis in this 10-year-old girl with fever and pain abdomen. Will the diagnosis change, Dr. Jivansha? Will you look at something else also?
Yes.
Probably hemolytic,
No.
ITP,
No,
what is
no,
called?
I'm
not be there.
Hemolytic
No, I think what is important to note is that there are many children who in the adolescent age group, especially girls, when they come to you as HSP, you need to watch them for SLE. They may develop SLE as they grow older. So it can confuse you initially. So these are girls. If they are girls, they need to be followed up more carefully for development of SLE.
Okay, yeah, very interesting point and very relevant also. Thank you, sir. So we'll go, so Jivansha has got this correct. Then we'll go to the next question, which is for Kunal. Look at the image and name the disease associated with it. Find out what is the abnormality. Time starts now. Yeah.
This looks like a scar to scrub typhus.
Excellent. So Kunal got it within seconds. So this is typical cigarettes burn appearance of scrub typhus. Sukumaran sir and Anand sir, you want to add anything to this? Your experience of scrub typhus in South India?
As we already mentioned, in case of meningococcinia, detection of the SR is very important, because again, late treatment may lead to complication. But the sad aspect of this one is that you will get such a skin lesion. In 50 to 60%, you will get in the covered area, for example, in the groin area, in the axilla, in the buttocks. So we have to expose you have to remove the cloth, and you have to completely look for the entire body for this session. You may get even I missed one case because of plantar aspects of the soul, so you may miss it like that. Treatment is very simple. Once you diagnose, treatment is very simple. Okay.
Okay.
Sukumaran sir.
Okay. We are also seeing children with scrub typhus. Look below the breast. Look at the buttocks, hidden areas. You can have this scar. Always
Yeah, especially hidden areas like the scrotum, axilla. I was first educated about scrub typhus by a urologist friend who made the diagnosis for me because I couldn't make it. And many a times now, we don't see the rash in all the patients. If you look at the data, they'll say rash is there from 4 to 60%. So very wide, variation. So if you have a fever which is not responding to the usual therapy, you should suspect scrub typhus. So excellent, Kunal. We will go to the next question for Deep Kumar. Name the condition in which this phenomenon is seen in a febrile patient. Look at the picture carefully and see what is there. Time starts now. Look at the back. Okay, anybody else knows the answer?
The blanchable rash.
Dengue.
Dengue, good. So those of you who have seen, this is a very typical rash. It's seen in dengue patients. You want to add anything, sir? Anand sir?
So you may get any type of rash, you may get a morphism rash, but the most important is a rash, blanching rash with the islands of the normal area, so it is very characteristic. And also you may get a rash of a purpura and other secondary lesions. So it is very characteristic. I think it is a diagnostic also.
Yeah. So Deep Kumar could not answer that. So we will go to the next person. Question number 7 for Anirudh. Look at the face of this child and tell what is this child has with this kind of a dirty kind of a rash and fever. Your time starts now. What are the most common organisms?
Streptococcus.
Okay. Can you qualify it further? We are asking the condition.
Highly crusting and
Okay. Any of the others you want to try? What is the condition?
Staphylococcal scalded skin syndrome.
Staphylococcal or streptococcal scalded skin syndrome. So Anirudh, you just said the organism. We asked you the condition. So sir, Anand sir, you want to add anything for this? You can display the correct answer.
Yeah. The answer is SSS, Staphylococcus streptococcal skin scalded syndrome. And also, I think a very, very serious condition regarding the children, and you may get you have to treat immediately with the anti-streptococcal medication. Supportive measures is very, very important. And also, you may get confused with the Stevens-Johnson syndrome and other rare conditions. But I think here there is no confusion. It is SSS only.
Sukumaran sir, want to add it?
Yeah. It's one of the bullous common condition that would say bullous lesion in a newborn. As Anand said, you must also think of other conditions like epidermolysis bullosa. It can also mimic a Staphylococcus scalded skin syndrome. But these children will be otherwise all right. Look well.
So when you are asked about the condition, you have to give the full answer. That is the staphylococcal or streptococcal scalded skin syndrome. So thank you. We'll go to the next last question in this round, which is for Akhila. Akhila, you can unmute yourself. A 3-year-old came with complaints of fever with rash. Further pathological examination revealed cells which are shown here in this image on the upper part. What is the best possible diagnosis? Warthin-Finkeldy giant cells, Koplik cells, giant cells of pneumonia, or none of the above? The time starts now. Please unmute yourself, Akhila. If you say anything, we won't be able to know.
Ma'am, they're Warthin-Finkeldy giant cells, ma'am. Warthin-Finkeldy.
Okay.
Warthin-Finkeldy giant cells, ma'am. Measles, seen in measles, ma'am.
Correct. So can we display the answer? So the answer is none of the above. So it was not seen. I'm not sure what is this also. So I'll ask Dr. Anand and Dr. Sukumaran, whoever has contributed this.
No, I think the multiple choice question.
I think it should be all of the above.
No, it is Warthin-Finkeldy giant cell only. Last time also the multiple MCQ, the answer got some problem.
Ma'am, sorry, there is some issue in the slide. The correct answer we have received is A.
A, na?
I think
That's what I was thinking. Okay.
Yeah.
So Akhila, you got it correct.
Yeah, Akhila is right. Akhila is right. It's what is right. Giant cell.
Yeah. Even I'm checking. Akhila is right. So she.
But madam, the one thing is that this Koplik spot also contains Warthin-Finkeldy giant cells. It can be seen anywhere, even in the intestine, in the appendix. It can be
so many viral infection you get such a finding.
Yeah. So since in our choice, this was at least the questions which were sent to me, the correct answer was marked as Warthin-Finkeldy giant cells. So we'll give the advantage to the participant. So we'll take it as correct. Okay, sir?
Okay.
Yeah. So we come to the end of the second round, and I'll request our team to the scorer to show us where we are, how we are posted at this point of time.
Yes, ma'am. We'll just need 1 more minute.
So Koplik spots are seen in where? They are seen in the histopathology or they're seen clinically? Students?
Clinically, opposite premolar. in the
Yes.
oral cavity.
So this is a HP picture, no? So the answer obviously won't be.
It will be
Yeah. In which condition it is seen, Coptic spots? Naveen, batao.
In measles.
Measles. Good. What is the neurological complication associated with measles, Kunal?
SSP.
Aseptic meningitis.
Okay, one more.
SSP.
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 But this is the rarest one. Common. You must say common. At least
Yeah.
10, at least 10 you must say as PGs. 10 CNS complications. You must say.
Yeah, 10 CNS. Deep Kumar, aap ekdam chup hai. Deep Kumar is absolutely quiet. Unmute. If you're saying something, you should unmute. Okay. So Akhila is 40, Anirudh is 20, Deep Kumar is at 5, Jivansha is 40. So we have a tie now, Akhila and Jivansha. And Mamata is 20, Kunal 15, Naveen 15, and Rushi 10. Very neck to neck. Two girls are neck to neck, I think. So great. So I think in the next will be like really fastest finger. So we will go to the next, right, Krishna? I would request Krishna to again show the rules so that they are not confused. And this will be, I think, the deciding round, and we don't have to do any extra questions.
This will be the rapid fire round. And this rapid fire question, there'll be 8 questions to all the participants. Anyone can answer. Whoever answers within the 20 seconds and the fastest right answer will be considered for 10 points. There'll be no bonus points. And this round can change the tides also. People can get maximum 80 points by this.
So
And
Krishna, they have to answer in the chat box.
Right. Yes. Options.
Because
This will be all multiple choice questions. You need not type the entire answer. You can just key in the option A, B, C, or D.
Understood?
The one question I had, Krishna, was is that 5 marks or 10 marks?
5 marks.
5 marks. 5 marks.
5 marks.
Sorry,
Okay.
yeah. 5 marks.
Krishna, you said 10.
Sorry. Yeah. Apologies.
No, it is 5 marks only.
5 marks.
Yeah. So it is very clearly you should understand that since all of you cannot keep on shouting, it is difficult to monitor who is the fastest. So you will type the answer in the chat box. And based on who has given the correct answer in the fastest time, we will decide the marks to be given to which candidate. Okay? Right? Fine? Yeah. So we will start with the, since I don't have to look at whom I have to ask first, this is for everyone. So let us have the questions.
And just give us 30 seconds.
Yeah, sure. Please keep your videos on. Akhila, don't put your video off. You'll be disqualified.
Okay,
After
one
scoring-
question to all of you. Which is the other situation in which you can get SSP other than measles? Again, gold medal. Can you get SSP in any other condition other than measles?
Japanese encephalitis infection.
Huh?
I'm not sure.
You're not sure. Then you can take a guess.
Japanese
I think Deep
encephalitis
Kumar is
infection.
looking to find the answer. You won't get the answer. Don't worry. You can get it. You can get it after measles vaccination. Okay, SSPE is a side effect of measles vaccination, extremely rare compared to natural measles, but it is known. Okay, so the only other condition where you can get SSPE other than natural measles is measles vaccination.
So till they get, the backend team gets our question, another question for you all. What is the most common cause of aseptic meningitis?
Mumps.
Mumps.
Good, good, good.
Good, good.
Excellent.
And what is the CSF sugar in mumps aseptic meningitis?
Normal.
Normal. Oh, it's zero. It is near zero. Okay. So if you have a CSF sugar which is approaching zero or near zero, then you have to think of mumps. Okay, so we get the last round. Will there 8 questions, fastest and correct answer. Okay. So start with the first question. All of you ready? Yeah, be ready to type on your chat box. First question, please. A 14-year-old boy presents with fever since 7 days, with loss of appetite and loose stools for 2 days. On examination, the child is toxic looking, febrile, with hepatomegaly. Blood culture has grown gram-negative bacilli. Identify the agent and the drug of choice. A. Staph aureus vancomycin. B. Strep pneumoniae amoxicillin. C. S. typhi ceftriaxone. D. S. typhi amoxicillin. Time starts now. You can type it as A, B, C, D, whichever you feel is correct. Can you, I think it's a very easy kind of an answer. So the correct answer in this was Salmonella typhi and with ceftriaxone. So choice C. Right. So let us see who has got it fastest and correct. In the meantime, sir, you want to add anything unanswered on Salmonella typhi?
I think clear cut question participated. I don't think because here fever is more than 7 days. That's the click. So in other days you make a short duration. Here it is 7 days duration. Those tools. Then appetite they are rightly mentioned. So it is some impression of gaiety. So I think answer is comparatively clear to Salmonella typhi.
So blood culture is the gold standard for Salmonella typhi infections, though it is positive in only about 30 to 35% of the patients, but we must always try to get a culture. As a resident or a PG student, this should be your first investigation which you should send. What is the other test which is typical? Like if you didn't have this blood culture with you and you're still awaiting, and you did a CBC, what in the CBC would indicate that this would probably be typhoid infection? Leukopenia. In children, we can have leukocytosis also.
Eosinopenia.
Eosinopenia. Very good, Kunal. Eosinopenia. So if the eosinophils are fastest also was given by Kunal. Congratulations. So how many seconds? I think he took just a few seconds.
Which is the condition in which, in this particular scenario, you will not use ceftriaxone?
So when they're allergic.
When you have elevated
transaminitis.
Transaminitis or more likely alkaline phosphatase? Yes, because ceftriaxone can cause cholestasis.
Cholestasis. Yeah.
So you have to be careful if you're going to use ceftriaxone in a child who's got hepatomegaly with salmonella. You need to check the LFT before giving ceftriaxone. Okay.
Okay, good. So can we go to the next question? Hardik, we are ready with the next question. Yeah, 9-year-old boy presents with history of hematuria. There is history of blood-stained stools for 3 days, 4 days back. Peripheral smear was suggestive of hemolytic anemia. What is the diagnosis and the causative agent? HUS, Shigella, HUS, E. coli, all of the above, none of the above. Time starts now. So this question was like, you know, Amitabh Bachchan giving only two choices. So it has to be either HUS, Shigella, HUS, E. coli, none or all. So what do you think, you guys? What is the correct answer? So the answer is HUS, Shigella. So the history, because of the history of blood-stained stools, so this is more likely to be Shigella dysentery, leading on to hemolytic uremic syndrome.
Ma'am, with even E. coli.
E. coli doesn't cause more, like if you talk of dysentery, it is more like-
Intro-invasive and like hemolytic and intro-invasive can.
Yes, but how common is invasive E. coli? It is mostly Shigella. When we talk of dysentery,
In the options, if both are given.
yeah, you have to choose the best. You have to choose the best and the most commonest one. Okay, Anand sir, and you want to say something about this?
Madam, it is a triad of HS means thrombocytopenia, anemia, and renal involvement. They are not mentioned here, but anyway, it's very clear cut. So it is a HUS with the Shigella one.
So if till we wait for the answers, I mean who has got it correct. Suppose you have a patient with diarrhea, bloody diarrhea, and encephalopathy, which is the most common organism? Any of you?
Shigella.
Pardon?
Shigella.
Shigella? Sure, not this time, not E. coli.
Yes, ma'am. If encephalopathy, it's Shigella.
Shigella, right. So Shigella, if it is Shigella dysentery, causes encephalopathy. So are we ready with the answers? With the results, sorry. So Deep Kumar has got it correct. And I'm so happy to see it because Deep has remained silent for most of the time. So thank you. He gets 5 marks. So we go to the next question after this. Question number 3. A 10-year-old boy presented with his 10 days history of fever, which was evaluated as a pyrexia of unknown origin. He had a history of unpasteurized milk intake 4 weeks back. What is the diagnosis and treatment? Brucella, rifampicin, doxycycline for 2 weeks. Brucellosis, rifampicin, doxycycline for 6 weeks. Rickettsial fever, doxycycline for 2 weeks. And rickettsial fever, doxycycline for 1 week. So your time starts now. Can you display the correct answer, please? Again, this question was also like, you know, giving 2 choices of both to confuse you all. And I think it was the duration of the therapy, which was important. So this, obviously, the history of unpasteurized milk will indicate towards a brucella infection. And the treatment for this is not for 2 weeks, but for 6 weeks with rifampicin and doxycycline. Anand sir, you want to, can you throw some more light if we get the...
Not very common in our area, but any case with a prolonged fever, PUL condition, with the history of returning from Gulf, or those who are taken milk without proper boiling, you have to think about brucellosis. As mentioned, the treatment, you have to give long duration treatment, and also clinically you get a hepatosplenomegaly and the history of PEO. So I think even though very rare, once in a while you get a chance at the Apex Institute, you get such a case.
I think one question I would like to ask the participants is, what is the single test which will raise the likelihood of brucellosis tremendously if you do an ultrasound of the stomach. Of the abdomen, not stomach, abdomen.
Calcified granuloma in the spleen.
No.
Splenic abs.
Absolutely.
That's it.
Splenic abscesses. Splenic abscesses are characteristic of brucellosis. So if you look at the paper which has been published by Mahesh Kore and others on a large number of brucellosis from rural Karnataka, the incidence of splenic abscesses is virtually pathognomonic of brucellosis. You rarely get it in any other condition. So if you find, yes, you can get calcification, but that's late. You're looking at a child who is coming to you after 4 weeks. At that time, you won't get calcification. You'll get abscesses. And these are very specifically subcapsular abscesses. And they can be picked up on an ultrasound. So if you find a splenic abscess on an ultrasound, abdominal ultrasound, you're most likely onto brucellosis.
I think this is something which you should keep in mind, especially when patients come from rural backgrounds. So most of the time, they would come with a history that they are directly drinking the milk right from, I've got 1 or 2 patients who said that they directly suckled on the cow's breast. So that kind of a history you should be able to elicit. So backend team, are we ready with the result? Yeah. So again, Deep Kumar has given the correct answer. Congratulations, Deep. Somehow I feel Deep has just woken up now. Good. So we'll go to the next one. Question number 4. 11 months old male presented with fever for 7 days, swelling of the knee joint, red lips, peeling of skin, cervical node. Investigation showed ESR and thrombocytosis. What is the diagnosis? You have all the choices, A, B, C, D. Your time starts now. So this must be very easy for all of you. I think all of you must have got it correct. Let's see who got it the fastest. So the correct answer is?
Only the time factor.
Kawasaki disease. So I think nobody should miss this. Very typical, less than 1 year, 7 days, knee joints involved, lips red, nodes, and thrombocytosis. So Kawasaki disease. And anything you want to add, sir? Kawasaki disease?
Usually you won't get thrombocytosis in the first week. All these features you may get first week or second week, but thrombocytosis will get late only.
Yeah.
But it's not rightly mentioned, it's not no problem.
Yeah. Sometimes we do get thrombocytopenia, especially below 1 year of age. And this kind of a patient who presents below 1 year would be a high risk, would fall into the high risk category, because those below 1 year have more of coronary artery aneurysms. And nowadays we are having to use not only IVIG, but also infliximab along with IVIG, so that these aneurysms do not develop. And below 1 year, you really get giant aneurysms. So this is Kawasaki disease, typical. The other thing one has to remember is that more and more these days, we are seeing atypical or incomplete Kawasaki. So they may not have all the features, or they will have features which are not very typical or not in the diagnostic criteria. So it is to be suspected in any case of fever, which is for more than 5 days. Can we have who has answered the fastest? So all of you must have treated Kawasaki by now. So again, Deep Kumar. So Deep Kumar gets 3, I think, correct in this round. Very nice. Deep, we'll go to the next question without delay.
I have a doubt. Like,
yes.
Even before starting the timer, if we answered, will it count? Like before starting the timer?
Before starting the timer, it will not come. You have to give the answers once the timer starts.
Like I have been typing before the timer and also after the timer starts, ma'am.
So you'll be disqualified, no, for that
No.
question.
And
Yeah, you please.
Fast, ma'am.
Yeah. So thing is that you please give
I
your
was
type
also
your
doing the same,
answers.
ma'am.
Type your answers. I know some of these are very easy, but the rule is you have to type the answer as soon as the timer starts and within that 20 seconds.
Okay.
Not before and not after. Fine?
Yes, ma'am.
Yeah. Okay. So we'll go to the next. Oraya fever is caused by Burgdorferi recurrentis, Bartonella bacilliformis, Treponema caritium, or Bacillus cereus. Time starts now. So you have to answer within this 20 seconds. So let us look at the answer because even I don't know what is the answer. Anand sir, what is the answer to this? Sir, unmute, sir.
This is B, Bartonella bacilliformis, but I don't know anything about Oraya fever.
So this is a, I don't know who gave this question. It is even we would have not been able to answer this. So gives me something to read about today evening, Oraya fever. Very fancy name.
What are specific MCQ questions made for MCQ?
So otherwise, Bartonella is bacilliformis is something which is there in which animals? Can any of you tell?
Cattle.
Cat.
Pardon?
Cattle.
Cats. Okay. And what is the disease?
Domestic animals.
Domestic animal.
Yeah,
Human
these
beings.
No, I mean cats in the.
Yeah. So what is the disease which is caused by this bacteria along with the fever which is named as Oraya?
Q fever.
Q fever.
No. Cat scratch. Cat scratch.
Cat scratch disease.
Cat scratch disease. Any of you can tell me what is the histopathological finding in cat scratch disease?
Granuloma formation.
Granuloma. There will be swirling and granuloma formation. The close differential diagnosis is obviously tuberculosis in our country. So many a times they will present with lymph nodes which are not responding to your usual therapy, and you will treat with antibiotics, the usual antibiotics, then you treat with antitubercular, and finally when it doesn't respond, then many a times it happens that you ask a history properly and you found out that somewhere near the lymph node drainage area there was a cat scratch. So this is, what is the drug that is used for this? Any idea? Drug, cat scratch fever?
They use azithro.
Azithro, okay. What else?
And doxycycline.
Mamatha, doxycycline, okay. So doxycycline. So any of these abnormal kinds of conditions, no? Scrub typhus, cat scratch, all these are the drug is doxycycline. So can we have, anybody got this correct or not? Did any of you know this? Okay, Jivansha Dua. Did you know the answer or you just guessed? So I think Jivansha guessed and she got a correct guess. Yeah, right?
No, I knew it.
Okay, you knew it. Okay, good. So that is very nice. So we'll go to the next question. Question number 6. 5-year-old develops severe abdominal pain, tenderness of 3 days duration, acutely ill with tenderness of the anterior abdominal wall and petechial rashes on the dorsal surface of the feet and hand. Urine analysis shows hematuria, proteinuria. What is the most likely diagnosis? Enoxacondyl, polyarthritis nodosa, juvenile rheumatoid arthritis, and homocystinuria. The time starts now. So please answer during this period. So, Sir Anand, you want to say something
I
about this
think it's
question?
a repetition of what we heard previously. So I think there's no any meaning. So I think it is HSP only. We already discussed everything about HSP.
Yeah, so this is a severe form, severe form of HSP, and that is supposed to be the correct answer. Why not polyarthritis nodosa? Any one of you want to tell me? Kunal, batao.
Ma'am, the presentation was typical of matlab,
HSP.
suggesting towards HSP. And we
Pan
see,
with-
ma'am,
It's with
in PAN, we also see, ma'am, necrotic lesions.
Middle size vessels are more involved than.
Okay. Akila, what you wanted to say something?
pan usually presents as a digital gangrene and all, ma'am.
And how many of you have seen how many cases of PAN versus how many cases of HSP?
2 of HSP, none of PAN.
Okay. Kunal, how many in PGI? How many HSP? How many PAN?
One PAN and I think lots of HSP.
Lots of HSP. Okay. Deep Kumar, Naveen, Rishi. So HSP is more common. PAN, if you see the entire literature, I don't know, maybe some 100 or 100, 200 cases in the world. Usually they will come very late with digital gangrene and hypertension. Okay. So this is the way they present. So can we have the answer displayed along with who got it correct? So common things first. No? Common things first. Okay. So what will be the drug you'll use for this patient? How do you want to treat this child who's so sick with severe pain, abdomen, hematuria?
Steroids, ma'am.
Steroids. So hydrocort, prednisolone, sick child.
IV prednisolone and IV
IV methyl prednisolone. Okay, good. Okay. Who has got it correct? Fastest finger. So again, Jivansha Dua has got it fastest. Very nice. Congratulations. And I think we come to the last few questions. Next question, please. Hardik. So question number 7, 11-year-old female child with low-grade fever, urticarial rash for 4 months. The rashes did not respond to any of the second-generation antihistaminics, but showed good response to steroids. Investigation showed ESR, elevated skin biopsy, leukocytoclasia, and in the upper dermis. So what is the diagnosis? A, urticarial vasculitis, B, angioedema, C, eczema, D, none of the above. Time starts now. So again, 11-year-old girl. I wish SLE was also one of the choices, but we didn't have. So the correct answer here is urticarial vasculitis. Anand sir, you want to add anything for urticarial vasculitis? Sir, unmute please.
It will last for a long time. That is why it is 4 months duration here. Unlike other urticaria, it will last long. And also in such a case, the skin biopsy may be useful, which we are shown here. A leukocytoplasia is a very characteristic picture of a urticarial basket.
Sometimes this could be the first presentation of a lupus. Can it occur as a first presentation of a lupus? Anand sir?
No idea.
Possible, okay. So in female children, when you have repeated, rashes, fever, low-grade multi-system involvement, then we have to think about SLE all the time. Even in this child, even though our first diagnosis as a clinical diagnosis would be urticarial vasculitis, I would still like to keep SLE in my mind and rule that out. And as we know in lupus, all the presentations do not come at one time. So we need to keep these patients on long-term follow-up. And most of the time, the C3, C4 test has to be done in these patients. So can we have who got the correct answer? Hardik? So Kunal has got it correct. Fastest answer. Good. So now we come to the last question of this quiz for Fever Foundation 2020. 14-year-old adolescent boy presented with complaints of recurrent fever since 6 weeks, sore throat at the onset of fever for 7 days, and weight loss. Examination revealed generalized lymphadenopathy and splenomegaly. Blood counts were normal. Differential count showed more of lymphocytes, and peripheral smear showed more of atypical lymphocytes. The heterophile antigen test was positive. The complications of the condition include all of the following except airway obstruction, encephalitis, nephritis, and pericarditis. Your time starts now. So obviously we're talking about, what are we talking about here? Which condition?
Epstein-Barr virus.
Infection. Mononucleosis.
In 14-year-old, it will cause infectious, mononucleosis.
Mononucleosis.
This is a presentation of mononucleosis. So here anything can occur excepting pericarditis. Anand sir, anything else you want to add about this, particularly in adolescent age group?
No, it's not mentioned about any hepatosplenomegaly, any other skin rash. I think they are not mentioned. So clinical picture is something incomplete. But since they are given heterophilic antigen test was positive, we can go for diagnosis. Okay.
So till we get the answers who has given correct, anybody can say what is the other name for this condition, common name?
Kissing disease.
Kissing
disease. Because adolescents, they go and kiss each other, so you can spread it like that, no? So Hardik tells me none of you have answered this correctly.
Wow.
So it says nobody gave correct answer. Okay. So we come to the end of this Fever Foundation quiz. Hopefully, let's see if there's any tie-up. And if there are tie-ups, obviously, we will again have 3 more questions. So I would request our scorer to please display the results as of now. What is the status? Yeah. So we have Jivansha Dua with 50 marks. She's the highest. Congratulations, Jivansha. Then we have Akhila with 40 in 2nd place. And the 3rd place is Kunal Kashi. So thank you so very much. Jagdish sir, I hand it over to you for your remarks.
Thank you very much, Rashna. And we had a wonderful session with all of you and Dr. Anand Keshavan, Dr. Sukumaran also joining in and giving their very valuable comments. It was a lot of learning for all of us also, because it was a revision of our basic knowledge in pediatrics. A lot of it was very, very interesting to look at. And I can tell you that all of you all were very good. And I really congratulate you. Of course, we had some quiet people like Deep, and we had some very exuberant people like Akila. So we we had a nice time, and overall a very nice quiz. And thank you, Dr. Rashna and Dr. Anand Keshwan, for conducting it so beautifully. And I now will request my good friend Dr. Yagnesh, who has joined and who has been here all the time, but he was only not willing to come on screen. He was hidden from screen, so he has now come onto screen for his comments on the show.
And it was an excellent skill, and it was a good learning experience for myself. So I learned a lot from both the experts, Dr. Rashna as well as Dr. Keshwan. Excellent quiz. And I congratulate the winner, Dr. Jivansha, and I also congratulate all others who had participated willingly and participated enthusiastically. So I congratulate all the participants for the excellent time. Of course, we would have loved it to be a physical one, but unfortunately, because of some issues, we could not organize it physically. But virtually also, it was an excellent quiz. Congratulations, Dr. Rashna and Dr. Keshwan.
Thank you, sir.
And I also will take this opportunity to thank Dr. Krishna, who's put in tremendous amount of effort to see that this is held without any hitch. And of course, our event managers who have done a fantastic job in in trying to move from one type of quiz to another type of quiz to a third type of quiz, and have done it beautifully. So I think we must congratulate them too. So thank you very much, and excellent job by the young ladies. And of course, we had Kunal also doing a great job. So congratulations to all of you.
So we hand over to Krishna, and before I hand over, thank you, Anand Keshavan sir, for giving such tough and some difficult questions. I hope all of you like the picture quiz, because medicine is all about vision, visual, all about the 5 senses. And thank you, Jagdish sir, for trusting me to conduct this quiz. I really appreciate the honor. And Yagnesh sir, thank you. I saw you joining and then you disappeared. But you was a quiet observer.
No, I kept my video purposefully off so that I may not be disturbing others. So, but it was excellent quiz. Excellent conduct.
Thank you. And Sukumaran sir has already left, I think, the group. So a big thank you to him also. He had given us some very important points. Now I hand over to Dr. Anand for his remarks.
Yeah, thank you, Rashna Madam, and thank you, Jagdish sir, and the Sugar Foundation team for giving this opportunity. And also, usually in the Indian Academy of Pediatrics also conducting KISS in a wider way, well appreciated program. I think you people know about the AEP KISS program also. Now we are about to in the final round. So I request all of you to participate in AEP KISS program also. Once again, thank you, Krishna and the Fear Foundation team for giving this task. Thank you.
So Krishna, over to you.
Thank you, Agnes, for joining in and for your valuable feedback there. Thank you, Sukumaran sir, for joining in and sharing your expert perspectives. And thank you for the quiz masters, Dr. Anand Kesavan sir and Rashna ma'am. Thank you. And also a big thank you for our teacher of teachers, Dr. Jagdish sir. When he was answering the questions, only one thing was, good that I passed out early. if he was his examiner, I wouldn't have passed any of his Viva questions. Thank you, sir. Thank you very much. And to all the participants, congratulations. You played it really well. And also for the winners, our FeFCon Foundation team will reach out to you and will communicate to you as well. Thank you very much. Sir. Thank you. And we expect everyone to join in for the evening session today, which starts at 5:30. Looking forward for all of you to join for the FeFCon main event, the 5th annual national conference, starting from 5:30 today. And tomorrow morning from 9 to 10, we have a breakfast session on antibiotic stewardship. From 9 o'clock onward, from 10 onwards tomorrow, we break into 2 different halls, one for internal medicine and another hall for pediatrics. Request all the delegates to join in at 5:30 today. Thank you very much. Looking forward.
Thank you. Thank you. It was great.
Thank you.
Thank you. Thank you. Thank you.
Thank you. Bye.
Thank you.
Thank you all.
Thank you, Rishi. Thank you. Thank you, Dr. Mamta. Thank you, Divanja. Thank you, Deep.
Thank you, sir.
Thank you.
So should I end the meeting?
Yeah, please. RX events, Dignesh, 1 second. Rishi, thank you. You can leave, exit. Deep, you can exit, please. You can stop the recording as well.
Recording stopped.
Divanja and Dr. Rishi. Thank you. You may exit, please. Yeah. Scorers up. Dignesh, who are the winners? Top 3?
Sorry?
Who are the winners? First is Doctor.
For Dr. Jivansha Dua and second is Dr. Akhila Reddy.
Okay. Second is Dr. Akhila Reddy, right? Okay.
Hmm.
Third place?
Sorry?
Third position?
Just a second. Third is Dr. Kunal Kashi.
Kunal Kashi.
Hmm.
Okay. Thank you. I think we'll close this session.
Screenshot of every round chat box, so that to be fair, I will cross check their number. Yeah, so that we are fair.